Okay, well, good afternoon. My name is Mark Werneke, and my background, I'm a full-time clinician. I work in a hospital-based outpatient rehabilitation center, and my particular focus of interest is spine patients, so I see bunches of low back and neck pain patients. My interest in collecting outcomes was driven by the fact that this is a very difficult type of patient. I don't look at it as pain, but an illness. So patients who present with lower back pain is the illness of low back pain. And the only way to understand and be able to manage these patients effectively and efficiently is to understand science coupled with collecting data. You need data at the patient's bedside. FOTO allows me to collect that information so I can think on my feet. So it's not only understanding, well, what do the clinical prediction rules say in treating this patient? How is the patient responding to your treatment? What's the story that the patient's telling you? And that can be quantified by collecting data during everyday clinical practice. So that's my interest in collecting outcomes.
My name is Nancy Rothenberg, and I'm Vice President of PTPN. And I'm here at the FOTO conference in lovely Knoxville. I was invited to come speak today to talk about how PTPN uses FOTO data in outcomes bonus programs with large health plans in California. And I'm very happy to share our experience because FOTO has been a really valuable tool in helping our network and our physical therapy members to get higher reimbursement for good outcomes and high efficiency. And I'm able to share that with the attendees here and tell them how they can do it as well. PTPN is a national network of physical, occupational, and speech therapists in private practice, and we use FOTO for our members. All of our offices, all of our private practitioners use FOTO in their practice to use it as both a clinical tool to help them with their patient treatment. They use the results as a marketing tool to physicians and case managers and other entities to show the efficiency and effectiveness of their practice. And PTPN uses the data as a whole to show how our network is different from other similar organizations that don't collect this data. And that differentiates us, helps us with our health plan partners, and just gives us a real, it gives us the ability to show that physical therapy is not a commodity, and that we've always said that our members, our physical therapy office members, are better than everyone else, and now we can actually prove it, or at least prove that most of them are better than everyone else.
My name is J.W. Matheson. I'm a physical therapist, private practitioner. I've been a physical therapist for 17 years in many different settings. I've worked in outpatient and then private practice, a little bit of academic settings. And as of January 1st, I made the leap. I am now 50% owner of a private practice in the Minneapolis-St. Paul area, and I've been affiliated with FOTO, using FOTO data and examining outcomes since 2006, so over the past 7 years. And I think especially with healthcare reform today, we need to stand up and not be afraid to be measured, and we have to use an appropriate tool to do that, to compare physical therapists, to compare clinics, to compare different practices. And we need data, and we need a solid measurement tool. And FOTO, with its computerized adaptive testing, with its risk adjustment, is extremely helpful in giving us a tool to analyze our practice, compare our clinics, negotiate with the contract payer, collaborate with the payer, and that's going to become increasingly more and more important as we see healthcare reform and changes over the next 5 to 10 years.
Hi, my name is John Childs, and I just want to share briefly why I am a big fan of FOTO. As a researcher, FOTO has been incredibly useful as a database of very clinically rich information to answer any number of important clinical questions about the outcomes within physical therapy and where physical therapy best fits within the healthcare delivery system. And as a practice owner, we widely utilize FOTO at Texas Physical Therapy Specialists because we know that by consistently collecting outcomes, our therapists are constantly monitoring their own performance. We're able to benchmark that performance against peers. We have a very active residency and fellowship training program through a collaboration with Evidence in Motion. And so our residents and fellows actively participate in FOTO as well. And so we find that that really deepens our clinical excellence culture within the company and helps our therapists deliver the best possible care for their patients.
My name is Scott Silvey. I'm a physical therapist and group vice president for Nuterra Healthcare Physical Therapy. I think most people equate value to the almighty dollar. We didn't even look at the pricing structure of FOTO when we went into this. We're striving for the best practice standards and quality of care at all of our partner clinics across the country. So it was important to us to look at benchmarking that would validate what we do as a profession and what our clinics do for treatments. And again, the benchmarking aspect was vital in that key. That was the value to us. It was a great alignment with, again, the quality of care we were trying to put forth with all of our clinics. And again, as I mentioned before, it was very important for us to do benchmarking, and more importantly, it was vital moving forward as a profession in rehabilitation, healthcare, and physical therapy to look at the benchmarking on outcomes. There's a lot of rumors of pay for performance in the future. The functional limitation kind of is the first step to that. That's mandated by Medicare later this year. In describing the value of FOTO, again, not from a dollar amount, but just the value it brings to our profession. We researched a lot of companies, and ultimately we made the decision on FOTO not based on a monetary value, but based on the value of benchmarking those functional outcomes. And again, I feel that validates us as a profession moving forward. And then really the components it looks at as far as patient satisfaction, that's hugely important for marketing. It looks at the efficiency and the effectiveness. And again, benchmarking outcomes for our clinical staff, that's vital. And again, it's vital in the role of moving forward with pay for performance in the future. Okay. Now, saying all that, this is a business and we do have to come back to the actual value from a monetary standpoint. That was really the second thing we looked at with FOTO, and really that just sealed the deal. From our opinion, we have 32 partner clinics across the country. It was a very easy sell to influence our physical therapy partners into using FOTO from a pricing standpoint. Again, looking at the value from a monetary standpoint, I feel like we're getting a bargain. FOTO in combination with our EMR product has made this new challenge of functional limitation reporting with the G codes and severity modifiers substantially easier in regards to both the education and the implementation. And we feel we are greatly ahead of the curve in the country because of using FOTO. I've been incredibly impressed with the level of support that FOTO has provided us. Again, we have 32 clinics that are scattered all across the country. That makes my job as kind of administrative and operational oversight more difficult because I'm not in the clinics on a daily basis. Therefore, I can't answer a lot of the questions in a timely manner for them. The experts at FOTO, as far as the support staff, the response time have always been very quick and efficient. And if it's a higher level question that perhaps they couldn't answer right away, they've always dug in, done the research, consulted with us as an operational management team before getting back to our partner clinics to make sure we're on the same page, and that's vital in this relationship that we have with our partner clinics. So again, the first thing we talked about was the value that FOTO provides, and the customer support response times. That's just another aspect to adding value of FOTO.
Why do I use FOTO? Began using FOTO for the explicit purpose of, well, a couple reasons, is to improve myself clinically, to look at how does it validate what we do, how does it show any things we can improve on through there, and kind of give us that feedback, and how can we compare ourselves to others and kind of know where we stand in that and how we can rank ourselves and then kind of improve from there. Why did I attend the Outcomes Conference? One, I was invited to speak on through there, and two, to kind of learn a little bit more about how I can use FOTO, efficiently. There's a lot of choices and a lot of things you can do with it. It's a tool that I'm trying to figure out how to use better.
And how many years have you attended the Outcomes Conference?
This is my first time to attend the conference. I'd say three things. It helps me become a better clinician. First, again, to validate what it is I'm doing correctly, and it can show me in the various categories overall and by body region and through there, and we're able to look at our efficiency and effectiveness through that. I know that the treatments we're using, we've selected, are indeed producing the outcomes that we believe they do. Two, I think it highlights some of the weakness or opportunities for us to improve in areas on there. There are certainly tendencies of treatment that we have that we may get in the habits of doing and think we're doing well, but when it comes back and test that, maybe we're not as strong in that area, or we could change things up or learn to do a little bit better at. And I think the last one, it does help with my clinical decision making on where I do choose treatments. I'm able to look at their functional limitations. I'm able to then design goals based on how they answer those. I'm able to reassess those with the status summaries on our constantly and see if we're moving in the right direction. And if I'm not moving in the right direction, I can reassess and change my treatments up to make sure I do.
Well, my company is Redoc Software, and we're an electronic documentation company. We're in 300 hospitals, about 600 private practice clinics, and we are fully interfaced with, or fully integrated with FOTO, in the sense that we can, right from our application, go to the FOTO application and bring it in to the different documentation, the different reports that are needed, and streamline the whole process for the treating therapists. Well, the FOTO team is, a group that's ahead of their time, and the time is finally catching up to the demand for the outcomes and to show the true value of therapy services. To be able to capture this kind of data in such a large database of 5 million episodes to compare the clinical outcomes is a phenomenal step in the right direction for the profession.
I use FOTO because it is a great way to objectively measure patients' ability to function in their world at intake, throughout therapy, and then also again at the end. And then we also like to use FOTO in our clinic, and I love it because I can look at what the average visits are for patients and try to compare where my treatments are and if they can match that or even be below that. So I've been a FOTO user for over 6 years now in our clinic. So I have attended the Outcomes Conference this year because I was excited to see and get new information on ways other people and other clinics use FOTO and how we might be able to use FOTO even more in our clinic for our advantages for our patient care.
I've been using FOTO since January of 2012. I was hesitant to use outcome systems before, and what I liked best about FOTO was that it had the risk-adjusted criteria, so it allowed me to compare apples to apples. It was the fact that I could be ranked nationally. I'm a competitive person, and our staff is competitive, so we know how we stand in the rest of the nation, and then again, it's because of that risk-adjusted criteria. My experience was fairly easy. We started the conversation in Q4 of 2011, and then we implemented it in January of 2012. And it wasn't that hard, but we're set up on an EMR. We use tablets. We email the surveys out initially, and then if they don't fill out initially, then we catch them with the tablet. And then the physical therapist, each progress note, interval, and discharge, has the patient fill it out. So there was a little hesitancy in the beginning from therapists, but they really saw it as a valuable tool for them to use, and now it's fairly easy.